So Danny's made up all my tablets here for the next couple of weeks. I'm just going to take you through everything. There's quite a lot. I'm just going to show you and describe what they are and what side effects they have. So it's still morning, Dan. When you take a camera and you can film, I'm going into the tablet. So what is it I take first? So this is a basic wee ducati tablets that we take every morning, and inside that we have, first of all, mycophenolate. Now this is these two big chunky brown ones. They're quite big, and you have to take these first thing in the morning. And you can zoom in this little bit here to show. And we take this with food. My brain's still not working right in the morning. It does take me a wee while to get going. But the mycophenolate are supposed to stop me taking the prednisolone, which are the steroids, and they come in lots of different milligrams. So there's, for instance, 5 milligram tablets. These are the little red ones. So that's the first lot of tablets that I take in the morning there. So quite a lot of tablets. We have the 2 mycophenolate, we have some red prednisolone, some white prednisolone, because I'm on 29 milligrams at the moment. Then we have like an antihistamine, because I've got this hypersensitive condition. So I take cetirizine, which is an antihistamine, and then these are slow release morphine tablets. So I'm on a higher dose at the moment because I've had that accident a few weeks ago. So that's what they are. So that's like 25 milligrams of slow release morphine called MST. So I've got to shove them down my throat first thing in the morning, along with the trial drug, which you keep in a separate place. It can't be opened until you actually take it, and that's called nintedanib, but we call that Nintendo. And that's really, really hard on your tummy. So like I said this morning, I had a really, really sore tummy. But yeah, so I had a banana this morning, first thing when you wake, and you've got to get them down your throat, because what happens is the slow release morphine only lasts for 12 hours. So I've took it like last night. So when I get up in the morning, like back at 7, 8, it's ran out, so I need to be taking that, and also the nintedanib as well. You're supposed to take that 12 hours between, but at the moment we're sort of taking it 10 hours, because taking it too late at night, at maybe 8 and 8 o'clock, I'm not able to eat late at night, because then it gives me gastro, even more gastro problems, and I get acid reflux during the night. So there's all these complications that you've got to try and get around to manage your tablets. And then the next load of tablets that I take, you can't take within a certain amount of hours between that. So things like omeprazole, so I'm on probably the highest dose of omeprazole. So these little yellow ones are 20 milligram tablets of omeprazole. So I take these twice a day, so I'm on 80 milligrams of omeprazole. I couldn't be on any more tablets to help with my tummy. I have got like a hernia as well that they found at the very beginning of my diagnosis in this first CT scan, that because of all the tablets and the long term time that I've been on the prednisolone, it just damages your tummy, and so does like the mycophenolate, all these biological tablets that I'm on. They are really, really strong, so they all mess with your tummy. Then there's a supplement called NAC, N-acetylcysteine it stands for, and that helps with the fibrotic part of my condition, and it's something that's not prescribed, but the consultant and any respiratory specialist will say that they like their patients to be on the NAC. So we just buy that ourselves, in the purest form ever, so either get it in capsules or, for instance, these capsules Danny made up, we bought the powder and we have like a capsule making machine there. And then this little bad boy here, this is for my diabetes, metformin. This morning I decided not to take it. It's another one that really, I think out of all of them, it really messes with my tummy. So my blood sugar was 6.5 this morning after eating, so that's pretty still quite low. So I decided not to take the metformin, and I just try and juggle that because there's nothing you can really do with the diabetes that I've got because it's drug induced, so it doesn't matter what you're eating, or it has no effect on your blood sugar whatsoever. My blood sugar tends to spike after lunchtime, and it's due to the tablets anyway, so I've cut down on the metformin yesterday and I never took it this morning because my tummy was just absolutely in bits. So that's the morning tablets, and then at lunchtime I take a whole load of different vitamins and things. I'll go through them another day. What else do I take? I have another diabetes tablet if my diabetes did go really out of control, high for 2 or 3 days, then I have this glycoside that brings you right down, so I can take a glycoside tablet if I need to there. Oh no, what you've not put in there? Did you put Buscopan in there? Aye,
yes, I did.
Buscopan, that's another tummy tablet. I never saw it in there, sorry. Buscopan. Now, originally, because I was getting lots of esophageal spasms and that, and this was from last year, we were just trying to figure out what was happening. Kept getting these esophageal spasms. Esophageal is your esophagus, which is it's this part that goes all the way down into your tummy where you swallow, and I was choking and couldn't breathe, and it was actually resulting in a yeast, a fungal infection, and I would have to take, what was that I took, Dan? It wasn't it's like an antibiotic for a fungal infection. I can't remember the name of it. Fluoctazide or something like that. So that's what I used to have to take for that, and it would clear it up. But the doctor put me on Buscopan to see if it would help with the spasms that I was getting. So now I'm on that, 3 of these a day. And I think it does help. Or, I might try and come off them, see if it stops, because I don't seem to be getting these spasms anymore, and it might be because it might be because I take them, yeah, but it also might be because I've not had any of these yeast infections for a while in my esophagus, because my diabetes is a wee bit more controlled. So it's one thing at a time, and whenever I change something, like my treatment plan is always changing all the time. And that's why it takes Danny so long, about an hour, to make these tablets up for a couple of weeks. And folk will say, why do you not get the chemist to do it? That's why. You're laughing there, Dan. The chemist is great, but there is always like some hiccups and with tablets and things. So we like to stay in control of it.
I'm the buffer between getting these right and getting them wrong.
I know. So I'll email in the doctors with my prescription, and sometimes they don't get it right either, even though it's written down in black and white, so you don't know what's getting handed over to the chemist. But anyway, we always have it in plenty of time and make sure that we're always stocked up, but we like to be in control of the tablets because my treatment plan changes all the time. So for instance, this week's goal is now to try and come down on the MST, which is the slow release morphine. Now I tried to do that before the weekend there because my sister from London had come up to visit me on Saturday, and I think was it Thursday night or Wednesday night I went down 5 milligrams, but then on the Thursday I took a spasm, first time for a while. Then on the Friday I took another bad spasm where I had to get doped up. So I just thought, no, I want to be fine for my sister coming, because it's all about quality of life. You can come down on these things, but it's the slow release morphine and things like that. It's not really for the pain. It actually helps my lungs. It helps me breathe better because my lungs are so tight and so small. So it's all about quality of life, really. So I went back up to the higher dose, but now I was a wee bit short of breath yesterday, but tonight I'm going to go down 5 milligrams on that and see how we go for a few days, and then next week we'll see if we can decrease the Prednisolone another milligram. So I've went to 29 milligrams. We'll try and decrease it to 28. So I know that people that have conditions like me and that have tried to come down on the Prednisolone, it's like a love-hate relationship. So I know that you are understanding what I mean here, how difficult it is. So I've got to 30 milligrams from 50. I came down in like 2.5 milligram increments there. But now we're taking it slowly because I've went into adrenal failure and almost died 3 times actually trying to come down off the Prednisolone, and also it gives you, shortness of breath, and you've got to weigh up what's better, the side effects to the tablets and having a quality of life, or being on less tablets and not being able to walk about or shower yourself or anything like that. So it's all a juggling thing, and it's my decision as well. So I'd much rather have a better quality of life and be able to do things, and that's my choice. And it's also my choice as well to stay indoors too, because the longer I live without getting any infection, then the longer I live basically. I've already exceeded my lifespan too, so that's something that I do. And I know a lot of people choose to want to go out and things and risk that contact and picking up infections, but it's just something I choose personally to stay in my own little house, and people can come and visit me. I can be in control of what happens as they come in the door. There's lots of infection control procedures that we've done and things. So there is just so much to explain and tell you about what we juggle and things. But what do you want to say, Dan? Nothing?
None.
Nothing. So that's a little bit about my medication. Is there anything else that I've missed?
Aye, the other 2 sides. You've only took through 2.
The tablets?
Aye.
Well, at night time really it's just you take more of these metformin, another NAC, no metformin, mycophenolate, that's the ones that should get me off the Prednisolone, but they're also used to prepare you for I'll end up talking about a lung transplant. They prepare your body for a lung transplant, so these are all immunosuppressant drugs, so that's why I have no immune system, and I'm not on the lung transplant list, and the reason I'm not on it is because I'm too fat. I've got to be 30 BMI, and it's a whole other story. I'll talk about that another day, but I've maintained my weight throughout and came down little by little, but being on high dose of Prednisolone, it's not because I'm eating too much, like a calorie count and everything, it just messes with your metabolism, it messes with the way your liver metabolises your food and things like that. There's some days I hardly even eat, and then I'll go on the scales, won't I, and I've literally lost nothing, or it's took me 3 weeks to lose a pound. But the good thing is I'm maintaining, I'm not putting any weight on, but it's just taking me so long to lose it. Anyway, that's why I'm not on the lung transplant list. I've probably got about 2.5 stone still to lose, but now that I'm coming down on the Prednisolone, hopefully for one of the reasons it might help me lose weight quicker. Another reason is it might help get rid of the diabetes as well, coming down on it. So there's good things that coming down on the Prednisolone, but there's also bad things as well, where it might send me into adrenal failure, and it might make my quality of life a lot poorer as well. So we'll just have to see how we go with that. That's another diabetes tablet. The Buscopan, which I said you didn't put in, but you did, And then, this is actually a contraceptive pill. And I have this other thing. You wouldn't believe it. But, again, talking about women and periods, but when I used to get a period, it used to affect my breathing so badly for weeks when I was menstruating that I could hardly breathe, a short of breath. Now it's called something and I can't remember what it's called, but that little, being back on the little mini pill has completely solved that. So whatever that is, we still don't know why I've got what I've got. It's so rare and just one of a kind, really. And then I take that time as with food as well. I would take another one of the Nintedanib tablets. That's the trial drug. Well, it's not a trial, I'll be on it now for the rest of my life, and it's slowing down the progression. And then more tablets there. I know, there's a lot of tablets. And this is at night time, so they're sort of spaced between. So that's my other slow release morphine tablets there. Another couple of omeprazole, especially at night time, because you're lying down and then acid starts to go into your throat and things, so the omeprazole help with that. And sometimes I'll wake up during the night and I've got to take a wee swig of Gaviscon and things, or sometimes I've got to sleep upright too, or maybe go into a different bed and things. Every day's different. You just got to manage the symptoms, to be honest. This is another type of antihistamine that I'm on at night, and then the same antihistamine I'm on in the morning. So 3 different types of antihistamine. And then what's this blue one called again? Amitriptyline. This is a new tablet. I thought, oh no, I'm not going on something else, but I was getting so much pains in my legs and things. That the doctor says, look, let's just try a wee 10 milligrams of amitriptyline and see how it goes. And it basically solved it straight away, so that was good. So that was for the neuropathy that I was getting in my legs. Anything else I missed out there? I think that's it basically. Oh, and I take, that is magnesium and zinc at night. So magnesium again, especially for cramping, so I've always took that for my legs, and part of the vitamins I take in the afternoon. So I don't take the stuff that the doctors prescribe because it's full of calories. I'm trying to lose weight, to be honest. It's called AdCal they give you, and it's full of oil and stuff like that, and it's a supplement of calcium and things for your bones, because my bones are weaker now because of the prednisolone. So I buy my own calcium, so I take my own calcium, and what else do I take in that?
Magnesium.
Well, I take magnesium at night, don't I? I take some probiotics and things
Turmeric
like that.
capsules.
Turmeric, yeah, so I take some vitamins in that in the afternoon. Take some B vitamins as well, because I'm pretty plant-based diet, so make sure that I've got everything that I need as well. So sorry it's such a long video, but as you can see, that's only a small part of what we do. Just with the tablets alone, there's a lot of other different treatments that we do too. Complementary therapy treatments and nasal rinses and other things. And oh, of course I've got the Laxido drinks too, haven't I, that combat things. Anyway, I hope it's gave you a wee insight, and for those that are tapering off of prednisolone, I totally understand. Been there, up and down. It's just a love-hate relationship, but you know, my choice is, you know what, if I've got to be on it and it's given me the quality of life and the things that I can do now in the house, and it's just so much better than the other side of it, which is sitting existing, because I've been there as well. Sitting existing, waiting on somebody taking you to the toilet, somebody washing you. It's not easy. It's not easy. Anyway, have a good day, and I'll check in with you later and share a little bit more of what we're doing today. We've got a busy wee day. Bye!